Welcome to Forever Youthful with me, your host, Dr. Jaishree Sharad. Lips are the most attractive part of the face, not just in females, in men too. Now imagine having thin lips. Sometimes it makes you look older and sometimes it makes you look mean. Lips comprise of the upper lip and the lower lip. The upper lip has a mucosal part, which is this part, and a cutaneous part, which is the skin part of the lip. The lower lip just comprises of this mucosal part. Now, lip has a well-defined border and that's called the white roll. The upper white roll has the shape of a bow. It's called the Cupid's bow. Now this is the Cupid's bow and the peaks are called the Cupid's peaks. From the Cupid's peaks to the base of the nose, you have the philtral columns and here you have the philtrum. Then you have the body of the lip or the vermilion, which is the wet part of the lip. Now as we age, the bone here tends to resorb, okay? And the teeth also go behind. Sometimes there's loss of teeth too. So the muscles which are pulling the lip up, the levator muscles, the zygomaticus muscles also tend to get a little loose, and so they're unable to pull the lip upwards. With all these changes, the upper lip tends to get thinner and it tends to roll inside with age. The lower lip also loses its volume. So what do? We can inject hyaluronic acid fillers into the lip to create a well-defined margin, to create the philtral columns, to recreate the Cupid's bow, and then to also give plumpness and volume to the body of the lips. The upper lip has 3 tubercles, the median tubercle and 2 lateral tubercles, and the lower lip has 2 tubercles. All these can be recreated with the lip fillers. Not just this, the surface around the lip also needs to be treated. So if the corners are downturned, we can actually give you a little tiny shots of botulinum toxin here to actually work on this muscle to lift this up. Secondly, we can give you a little bit of fillers here to again lift the downturned corners upwards. These perioral lines here can also be treated by tiny shots of botulinum toxin injection, and we can also inject either skin boosters or we can inject a very light, thin hyaluronic acid into the lines. These lines are called smoker's lines. Now the upper mucosal lip and the lower lip volume can either be equal, or ideally Caucasians like it as 1:1.6, which is called the phi ratio. Also, when you look at the profile view, if you drop a line from the subnasale, which is this point, to the pogonion, which is this point, so if you drop a line like that, the upper lip should project 3.5 millimeters ahead of the line and the lower lip should project 2.2 millimeters ahead of the line, which means the upper lip is projecting about 1.3 millimeters ahead of the lower lip. Sometimes in youngsters who have thinner lips, or if they want slightly more well-defined lips or a little pout, you can do hyaluronic acid fillers, but the key is again to keep it natural and never try to ape and look like somebody else. So do not ask for lips like Angelina Jolie or Kylie Jenner or Kendall Jenner. You have to enhance the shape of your own lips and make them look attractive and beautiful. And also remember, less is more and keep it natural. In guys, we can also do hyaluronic acid fillers and just recreate the shape of the lip. And if the lip is rolling inwards, especially in older men, you can build volume and just make them look more youthful. Do not overdo once again. And if you have comments, post them here, ask your questions. I shall be happy to answer all your questions. Like and share this video and do not forget to subscribe to Forever Youthful.